Hello, and welcome to Voices in Leadership During Crises. I'm Sara Bleich, Professor of Public Health Policy at the Harvard T.H. School of Public Health. I'm also the Carol K. Forstein Professor at the Radcliffe Institute for Advanced Study. Voices in Leadership focuses on effective leadership to create positive change in public health. During the coronavirus outbreak, our regular series has been modified in two important ways. The first is that we will be broadcast using Zoom. And the second is that we're creating a very special focus on what it takes to lead in crises, especially during this global pandemic. Today, we welcome Dr. Stephanie Ferguson, and we'll discuss the critical role nurses play during these times. Dr. Ferguson is a global healthcare consultant with more than 35 years of experience designing, implementing, and evaluating health-related strategic plans and programs. She has worked in more than 100 nations as a technical advisor, consultant, and facilitator for the World Health Organization and the International Council of Nurses. She is currently serving as a visiting fellow at the Harvard T.H. School of Public Health. Stephanie, welcome to the program.
Thank you for having me.
So over the next half an hour, I'm hoping we can talk about domestic issues and international issues related to the role of nurses during COVID-19. And I want to start on the domestic side. And the first question I'd like for you to think about is Congress has already put over $2.5 trillion in stimulus funds toward helping address the COVID-19 pandemic. And there are more stimulus bills are expected in the coming future. And so as you think about the next 6 months, what is the single most important thing that Congress can do to meaningfully impact the pandemic when it comes to nurses?
Well, it's two-pronged. First of all, we have to get testing right. We need to test, we need to track, we need to isolate the infected people with COVID-19, everybody in our nation. So that's number one. And we need to open up our healthcare delivery systems. And when I say healthcare delivery system, I mean the public health infrastructure, all the community-based clinics, all the acute care settings, all the ambulatory care centers. We need to start doing our elective surgeries. I think sometimes people get confused when they hear the word elective, that it means it's unnecessary. It is necessary. It just means that we need to postpone it. So we've postponed elective surgeries now for some people up to 8 weeks. And this is unacceptable. So we need to get back to work, Sarah. We need to make sure that people are vaccinated. If we don't get this right in the next 6 months, we're gonna have COVID-19 and flu season all at once. And that's not gonna be acceptable either, because we want to make sure we don't have so many deaths. So people need to be vaccinated, people with respiratory disorders, they need the flu shot. Everybody needs the flu shot. Everybody that has a respiratory disorder needs to work with their pulmonologist and the advanced practice registered nurse to get their pneumovax, to get Prevnar 13. We could go down the list. And this is across the spectrum for every population. Our children need to be vaccinated. You know, one of the things I'm worried about, we will have COVID-19, we will have the flu and measles outbreak all at the same time. So let's do the right thing with this. Let's open back up our healthcare delivery systems.
And one of the things, Stephanie, that this raises is this issue that we hear about all the time in the news, personal protective equipment, or PPE. And, you know, it's been an issue of nurses not having enough to go around. So I'm curious what your thoughts are on where things are right now. And assuming more states begin allowing elective surgeries, how do we protect nurses with the right personal protective equipment to make sure they don't also get sick?
Exactly. I mean, it's unbelievable. Can you believe in a first world country like the United States of America, we don't have enough personal protective equipment to take care of our frontline people, which are our nurses and our other healthcare workers? I'm very disappointed, and it's unacceptable. So here's the thing, get your act together, everybody, and start ramping up production. We have two things going on now. We're telling people if they want to go back to work, they need the same gear. So if we want to get our healthcare delivery systems open up, we have got to make sure that every nurse and every healthcare provider has the equipment they need to be safe. And then we also need to make sure that the people who we are trying to get back to work and get our country back working also need gear so that they can be safe. So we need to ramp up production, Sarah. We need to do it now. I don't care how many companies that our government has to put under the Defense Production Act. get your acts together and let's start doing it now. We have to have it. Otherwise, we're going to lose our nurses. And this is what I tell people all the time. This is a matter of national security. If you have nurses who are getting infected and dying, then you don't have a healthcare delivery system, and then you don't have a country anymore. So this is how serious this is. Do the right thing for nurses and other healthcare workers. So we are your frontline people, and we're able to do what we need to do to care for all the people in our country and all around the world.
So, you know, one thing I've read, Stephanie, is if you sort of assume that we can solve the personal protective equipment issue, which is obviously a huge issue, it sounds like there are other challenges. So furloughs and licensing challenges. So what do we do about those to get nurses back to work?
I know, once again, unbelievable. Can you imagine we are in a pandemic and we are furloughing and laying off nurses? And when I hear that, I just shake my head. Basically, this is the last people that you need to be laying off is your healthcare workers. So if anybody's listening to me, find the money to pay the healthcare system so that they can bring their nurses back to work, get them out of furlough, and get them where they need to be. They are your frontline workers who can do public health, testing, tracing, contact tracing, isolating the people, going into the homes, going into the apartments and wherever people live in the backwoods of Virginia, in rural and urban settings, and really work with people to help them get well. And but if we have nurses on the sidelines now, also getting an unemployment check, it's unbelievable. I mean, look today, more than 30 million people are unemployed. And think about all the nurses now around the world that are unemployed. So I'm not feeling the love. I'm gonna tell you, Sarah, I'm not feeling the love. We need to bring our nurses back to work. The other thing we need to do, we do need to tear down the barriers for our advanced practice registered nurses. They are essential health providers. They are innovative, they are creative. They know how to set up nurse-led clinics. They already run their nurse-led clinics. They can do all things and be a frontline provider and make sure that we get people, once again, tested, in treatment, isolated. They can use telemedicine, telehealth, all sorts of mobile technology to get to people and care for them. But guess what? A lot of our states don't let our nurses nor our advanced practice registered nurses practice to the full scope of their license and their nursing education, their knowledge, skills, and abilities. So I want to thank those governors who are already finally seeing the light and breaking down those barriers. But for those governors that might be listening to me today, including our political people in Congress, let's tear down all the barriers to the practice of nursing, please. We are in the International Year of the Nurse and the Midwife. We're in a world pandemic, global pandemic. Let's do the right thing. So that's my thing, Sarah. It is mind-boggling to think about the fact that we don't have our frontline personnel nursing, advanced practice nurses at the front level where they need to be. So it goes hand in hand. If your healthcare delivery system is shut down, I get it. If your healthcare delivery system is shut down and everything is COVID-19, you don't have enough protective gear to care for the people. You don't have enough money to pay the nurses. It's a vicious cycle, but we need to stop that now. We need to open back up. We need to open America's healthcare delivery systems, and all our providers, our nurses in advanced practice, registered nurses need to be allowed to work to the full scope of their practice and get the gear they need and get to work so we can turn this around.
And you mentioned, Stephanie, that there's lots of undertreated illness right now. So some people, it's going on 8 weeks now, they haven't gotten treatment for elective surgeries. And so as we think, obviously that's a general problem for people, but are there specific populations that you are really worried about during this time?
Yes, Black and brown people. Now let's keep it real. When you see who's dying right now, you see a lot of Black people are dying, a lot of Latino people are dying, a lot of Asian people. We could go down the list. And yes, of course, there are a lot of other majority people who are dying. But I want to talk about Black and brown populations. We've got to get them back into the healthcare delivery system. If this is a virus that likes a host who has comorbidities, everything from diabetes to respiratory disorders, to cardiovascular disorders, to cancer. If we think about populations that are suffering from all of that, I think about brown and Black people. So we've got to be innovative and creative. We've got to get out and test this population, all this population of brown and Black people in our country. We've got to get in there and educate them. You know who can do this and who is a respected, trusted persons in their neighborhoods, in rural and urban? It's the nurse. It's the public health nurse. It's the advanced practitioner. It's the community health worker. And one of the best things about nursing, we know how to work with everybody. We know how to set up the clinic. We know how to make sure the clinic is safe. We know how to collaborate with everybody in the community, the barbershops, the hairdressers. We know how to work with the community-based food supply, the markets. We know how to get everybody together. The houses of worship. We know how to engage the spiritual side. We know how to work with the media. You know, people need to realize not everybody's looking at Fox News and CNN every day. Black people are listening to different mediums, if you will, to learn about what's going on in their communities. Same thing with Latino populations. I love it. Everything's on is English. How about you need to be speaking some Spanish too? So I think that that is one of the things that we've got to turn the corner on. And so I can't say enough. Give us our personal protective equipment. Let us practice to the highest level of our scope of practice and licensures. Let our advanced practice nurses get out there with all of our collaborative organizations that we work with in the community every day. The faith community, the public health department. We work with everybody who got the soup lines going, got food delivery services, the barbershops, etc. Let us do our job. Let's turn this around. One thing I know as a Black person, once we are able to get out into our communities and work with our populations, and also with the Latino population, the Asian, I'm talking about everybody, the Native American, everybody, we are able to get the message out. People trust us. We are able to teach what COVID is and is not, how to protect yourself and your home family. And the other nice thing about us, we're able to also treat your high blood pressure. Look and see what you're testing now with your diabetes. Look at your diet, and you know about this, Sarah. Let's see what you're eating. You know, we need to get with people and let's see what you're drinking. And let's see and how we can help you, because guess what? We know you're addicted to opioids. We know you're suffering right now with mental illness and all sorts of things going on. Who wouldn't be? You've lost your job. You don't know what's going to happen next. You're standing in line trying to get your next paycheck. You don't have internet services. But that's the beauty of nursing. We can get in that whole house and not only take care of people who are infected with an infectious disease, but also care for all the other diseases that they have.
I think we need to put you in charge of it, Stephanie.
Yeah, well, listen, I've been doing this all my life, you know, and it's all about leadership. It's all about leadership. And I appreciate Harvard inviting me today. You know, what we have going on is several things. One, a lack of leadership. Let's call it what it is. If you don't have command and control in a situation like this, then you have chaos and conflict. And what we have, as we say at WHO, we have an infodemic. We got everybody and their mother and their aunts and all sorts of people telling the story about what they feel is the narrative with COVID-19. And there's a lot of miscommunication. So I think one of the things that people need to understand, nurses are used to dealing in these type of situations. And I'll tell you one thing we're good at is command and control, because most of us don't have a lot of time for stupid foolishness and people who just don't understand how to take care of people and how to save a nation. So thank you, Sarah, for that. There's a lot of nurses like me out there. So let us do what we know best.
So you mentioned WHO, so let's switch gears and talk about the international side.
Okay.
So I started this conversation by saying, in the US, what's the single most important thing we can do in the next 6 months? Now I want you to think internationally. In the next 6 months, what is the single most important thing that we can do to try to get our arms around COVID-19 from a nursing perspective?
It's the same thing. We need to invest in nursing. Now, the World Health Organization just came out with a landmark study that really is the report like none other that they've ever done about the state of the world's nursing. The state of the nursing is the world report. So if you haven't seen it, you can go on to the World Health Organization. You can actually go on my website, leadwithstephanie.com. I did a whole blog on it just to help people understand. I actually, I'm a very serious practitioner, public practitioner and advocate and health policy person, but I sent it to 150 plus ministers of health that I personally know and said, you need to read this, you need to look at this, and you need to understand COVID-19 is here. It is a pandemic. You're not ready in your country. So my thing would be, once again, it's two-pronged. Figure out how to get your testing right. Figure out how to get your protective gear for your nurses. If the nurses get sick and die, there will be no healthcare system. That country will fall apart. So from a national security perspective, it will be game over. And so they need to understand you got a little bit of time there to prepare. Just look and learn from some of the other countries that have not been able to deal with this situation in a good way, including my country, tis of the United States of America. So look and get yourself together. So it's the same thing, Sarah, but we need to invest in nursing. One of the things that came out with the report for the State of the World of Nursing report is we know we're down 6 million nurses. Now, my thing is this, with everything that's going on with COVID, we know health workers are dying around the world. I don't know if you've been keeping up with this, but we sort of feel like that maybe 23,000 might be dead now. I don't believe any of those numbers. I believe there are more nurses sick than we know, more health workers sick than we know. But here's the type of people we are. We will work until the last breath in a situation like this. And so bottom line, we need to get our data and monitoring right. We need to make sure we invest in nursing. We need to make sure that we change our nursing education programs around the world to focus on public health and primary health nursing.
So you said,
go ahead. No, you go.
You said, Stephanie, that we need to listen and learn. So as we look around the world, who is doing it right now when it comes to COVID-19?
All right, well, let's start with Africa. I don't know if you saw, there was a great segment on BBC where they highlighted the African nurses, particularly in South Africa. And many people know I've spent a lot of my life in all of Africa. And I was so proud of them because basically they did protest with their government and they said, no personal protective equipment. We're not going to go to work. And so therefore you're going to be sick and we're sorry, but we need what we need. And those people in the government, they heard their nurses, because the South African nurses, they don't take any, they don't, they actually, they don't do well with stupid. And so I love them. And so bottom line, when the BBC said that they were doing a great job on the lockdown, and they showed the nurses with their protective gear on, they showed the nurses testing, they showed the nurses going from house to house and everything. And so that's a good example. The South Korean nurses, great example. The nurses in New Zealand, great example. The nurses in Italy, great example. Look what happened in Italy. We could go on and on. The nurses in Hong Kong, the nurses in Taiwan. Listen, the nurses in Wuhan. I mean, let's just call it what it is. They did the best they could do to keep China on the face of the earth. They're still in the front lines trying to do that. So those are some good examples that I feel like people have done a very good job with this. And also in Europe, there are other countries now. Let me do a shout out for Germany. I mean, so Sarah, there are people now who are watching what I call the hot zones, and they are looking, they're listening, and they're learning best practices. And they're looking at people and trying to figure out and determine what they need to do so they don't look like the people who have really had a bad time with this.
So you mentioned that this is the year of the nurse and the midwife. And you also mentioned that tragically, we have lost a lot of nurses. Potentially it's underreported due to COVID-19.
Yes.
So there's a short-term problem when it comes to nursing, and there's a long-term problem when it comes to nursing. So how do we address these shortages in a meaningful way?
Well, once again, the first thing we need to do with the shortages is to understand that we have a shortage. And so we need all our countries to invest in nursing now and nurses. We need all of our countries to make sure that we have the right regulatory systems in place. And when I say regulatory systems, You have to have a regulatory body in nursing that's able to work with academic institutions, accredit those institutions to make sure those curricula are right, and also to make sure that the licenses that the nurses have to practice are fulfilled to protect the citizens of the world. So we need to work on that in the short term. But the main thing is we got to make sure now in the middle of a pandemic that the nurses have all the resources they need. One of the things that we're going to have to do, Sarah, is we're going to have to enhance our mental health services for nurses. This is a war. And when you have, if anybody just listened to me that's been in the military or been in a war type situation, a person like me who's worked with nurses who have worked in SARS, Ebola, avian flu, swine flu, Marburg's disease. I mean, we can go down the list. You don't come out of those situations as the person that you were when you went into those situations. It changes you. It changes your family. So we need better mental health services. I'm seeing and watching people, a lot of times I notice people are putting up a webinar. Okay, that's great. But I know this, when a nurse is at the last leg now, thinking, I can't take no more, they're not going to be looking at a webinar. They need somebody they can talk to. They need a nurse practitioner who has a specialty in psych mental health nursing or a clinical nurse specialist. We have lots of them, by the way. We need more of them. They need a clinical psychologist. They need nurses who are doctorally prepared, not only the advanced practice RN in psych mental health nursing, but they are also a clinical psychologist. They need the psychiatrist. They need to have interaction and talk to people. When you are down, when you're depressed, when you're sad, when you're ready to commit suicide, I don't know too many people who are like, oh, I think I'll look at a webinar. No. Now, I do think that you need those type of materials once you get people through the crisis, and so that you can keep them whole. But we have a double whammy going on now, because we also know that we as nurses, we need to not only have mental health services for ourselves, but we need to be able to give that care to our patients. This is, a lot of our people are not used to being sick like this with an unknown virus, a virus that there's no cure, there's no vaccine. We think it's asymptomatic. We feel like, we have to wear our mask. I mean, look at me. I just don't have it on. But this right here, I have survived in many jungles and all over the world, wrapping myself up. But in solidarity with my nurses and health workers around the world, I am not wearing an N95 mask. And so, but the bottom line is what I can do is do just what I'm doing now, which is I'm very powerful. Thank you. And I have a lot of influence. And so I want to make sure that the nurses get what they need. So on the short term and the long term, we've got to do the right thing to protect our nurses. We've got to invest in nursing now. And we have been trying to get people to understand this for many years. And so, we're in a perfect storm now. And I always like to say that when you're in a perfect storm, there's going to be a perfect new beginning. And I'm very optimistic that we will get through this. But we need to make sure that we do the right thing now and invest in nursing, scale up our mechanisms for monitoring the health workforce and including our nursing workforce to see who we are, where we are, so we can put the right nurse in the right place at the right time to be able to care for people who are both suffering from an infectious disorder and a non-communicable disorder. And
so you mentioned that we need to help all nurses right now. So let's not just think about domestic nurses or international nurses. Let's think about all nurses. And you've mentioned sort of PTSD from dealing with COVID-19. I suspect burnout is another thing that we have to be worried about. But from a nuts and bolts perspective, how can we better leverage things like telemedicine? So how can we use technology right now to help nurses all around the world better do their jobs?
Well, first of all, let's get the broadband right. I tell you, I have been on every Zoom, WebEx call in the world, but none of it works if you don't have internet. So if you want to do telemedicine and telehealth and all of those technologies, then you better get your internet and your broadband, your internet services in order. I'm in the backwoods of Virginia, and we're on a lockdown, and our nurses and also our doctors and other healthcare workers and our teachers and everybody have to go to certain spots now to set in their cars and to get Wi-Fi services or any type of satellite internet services. So that's number one. So, but my thing is, let's invest in that, because I am a totally technology oriented and driven person. I think that it makes your life better. I think that it helps you work faster. And so I feel like that this is the time to use those services. So let's go back to mental health services. You can use those services with mobile technology. You can, certain phones, you can FaceTime, you can do all sorts of things. You can text each other. Lately, when I've been given, people write me and say, this is Stephanie, I'm going to tap out of this. I'm like, can I call you now? They're like, no, because I don't want you to see what I look like. I'm like, can you text me? So there's all kinds of ways we can do it. But I would say using mental health services is a start for that, because we know we can get a group of thoughtful health workers who are trained in counseling and mental health services. We can do trainer of trainer with other nurses who and health workers who understand mental health care. We can then take that to the next level, and we can make sure you can get the right person to care for you. Is that the advanced practice RN who is specializing in psych mental health? Is that the clinical nurse specialist who's doing that? Is that the doctorally prepared psychologist? Is that the psychiatrist? So I think we need to build those out there now worldwide, because people will leave the units at night, can't go home now because they're worried they're going to infect their partners, their families, and everything. I've seen nurses live outside, live in tents. It's unfortunate because they might, they don't have housing. And I think that we need to do the right thing so that they can be able to dial up to text somebody and say, I had a rough day. I had a really rough day. I feel like I went to the morgue more than I did to go check on my patients. That's how many people died today. And when you have that type of thing happening in your life, you need to talk with somebody.
And how about,
go ahead.
I'm sorry, Stephanie, how about the role of telemedicine for helping nurses care for patients? Do you think that is now here to stay more than it was before?
Actually, I hope it is. This is a perfect storm. The curtains, have been pulled back. All the things that people try to hide under the sheets and under the bed and in the closet. And listen, it's all out in the open. I hope we do not go back to the way we've been doing healthcare in our country. What I hope we go back to is public health 101. And what I hope we go back to is primary health care. What I hope our country goes back to, and every country in the world goes to, is universal health coverage. Most people know I'm an expert in that. I've been talking about it. You see, I've been talked about it so much, I'm great. But the long and the short of the story, we need to make sure that people have essential health services. This is great for, in an odd way, it's actually good for people to see what it's like not to have a healthcare delivery system that has a decimated public health infrastructure that has happened over the years, that doesn't even have the capability to give the health workers what they need to be mentally well, to be physically well, to protect them from any disorders. And then we don't even have the resources to be able to care for them when they get home, because our country has shut down over one pandemic and virus. So this is really, it's taking people to the realities of where our country in the United States of America needs to go, but where the whole world needs to go.
So I have a final question for you, Stephanie. Yeah. And one of the reasons that I love talking with you is because you're eternally optimistic. When we look at COVID-19, there's been a massive economic toll. There has been a massive human toll. We've talked a little bit about that in the context of nurses. And so I want you to try to leave us with some reason for hope. And so what can we look to think about nursing leadership right now, and things that we should say, these are reasons that we should have hope right now when it comes to COVID-19?
Well, we should have hope right now because nurses have been leading in crisis all their career. Every nurse in the world. We are resilient. We are responsible. The nurses are respected all over the world. We are able to do all things even when some people don't respect us, don't treat us right, and don't give us the resources we need to be able to do our jobs. We are going to be there 24/7. We are going to be there. So we rock. Our world rocks. And so I have hope because I've lived through so much in my lifetime around the world with nurses who've been on the front lines. And I'd like to say that many of us, and probably some of them listening to me today, we have this saying where we write each other and say, I'm still here. So in closing, Sarah, I just want to say this. One of my favorite scriptures is Micah 6:8. And I know everybody doesn't have a spiritual context like I am, but you know, I am a believer. But let's put it in the context of when all that happened, when that scripture was written. The ancient Romans used to say salvator ambulando, which means it's solved by walking. So as nurses, we know this to be true. So often we do not know where our journey will take us, but in walking toward those in need, in the experience of doing for the sake of others, truths are revealed. So without getting emotional, truths have been revealed. But we have hope that this is going to turn the tide. It would be easier now to postpone decisions, to look in the mirror and say, let's not do testing anymore, to not have, make critical decisions because we don't know all the answers. But what I know about nurses is we feel more comfortable when we act and when we take and go down that paved road and that unpaved road, so we can make sure that we care for all the people in our country. Nurses in the United States of American citizens and all the global citizens of the world, we will rise to the occasion, Sarah. And so what we need to do now is to look, listen, and learn. Great leaders are always thinking. They're always doing their assessment. They have good insight and judgment. They know how to do command and control. They are effective communicators, and they will do the right thing because that's what leadership is. So let's all be humble. Let's embrace this adventure, and let's keep walking.
Thank you, Stephanie, for your enthusiasm and for your candor. And to all the members of the audience, thank you for joining us today. Yeah. We'll be bringing you more voices in leadership during crises in the coming weeks. In the meantime, take care and please stay safe.
Thank you.